Hi, my name's Ellie West. I'm the Environmental Sustainability Lead for Linnaeus, and today I'm talking with Ian Battersby, who's an antimicrobial resistance and stewardship expert. So we're going to start with today, why is antimicrobial resistance such a problem?
So antibiotic resistance, essentially that means that the antibiotics are becoming less and less effective against bacteria. The bacteria are evolving mechanisms to resist the effects of them when you're trying to treat infections. So obviously this means that infections that have been treatable for the last 40, 50 years since penicillins were introduced will gradually become untreatable, and we potentially could result in a situation where we're in almost like a pre-antibiotic era.
So that reduces our ability to treat many of the common infections that we're dealing with today?
There's a huge impact. I mean, it's simple infections that we would consider very routine to resolve would be potentially untreatable, but also a number of operations that we routinely perform, they require antibiotics to be used in the surgical, during the surgery. And if there's resistance to those, then obviously they won't prevent the infections happening in that situation. So, not only is there an infection issue, but there's also routine procedures will soon will become no longer routine and high risk.
And that's not just a challenge for pets, is it?
No, this is I'm sure people have seen, in humans, this is becoming increasingly talked about. There's campaigns about it, although some of the experts in the human field describe this now as the silent pandemic, because why this is happening is that we've been using antibiotics in a lot of conditions when we didn't really need to use them. Bugs are very adaptable, they reproduce very quickly, and we put a selection pressure on them, like a selection of the fittest. So the fittest bugs who are able to resist the antibiotics are now getting opportunities to flourish. So there's a big issue in the human field, but as vets we need to also consider the impact on our patients. There's a complex argument about how our antibiotic use might be influencing the development of resistant bugs in the human healthcare, which is a complex issue, and there's a lot of clever people looking at that. However, the fundamentals are that if we overuse these antibiotics, they will become ineffective for our patients as well. And then there's also the complex issue of regulation. If we're not shown if we're not demonstrating as a profession that we respect the privilege that we've got to prescribe these antibiotics, then regulations may come in to restrict the ones that we've got available.
And something that I found very scary is that there haven't been new classes of antibiotics produced since the 70s.
Yeah, 70s, 80s, and if you look at the timeline, I mean, I think just before World War II, the penicillin was licensed, and that came in, and within 10 years there were Staphylococcus bacteria that were appearing in labs that were resistant to penicillins. But that was fine because people were identifying new antibiotics. So then it's okay, we bring in another antibiotic, and then there's a timeline where you can see one new class appear, and then resistance becoming prevalent and it becoming an issue.
But this isn't just about using less antibiotics, about saying, well, we're just not going to treat those infections. This is about using the right antibiotic.
Absolutely. I mean, we still, it's a fine line on a message, really. We still want to be able to use antibiotics to help patients, human patients and animal patients. However, what we have to recognise is if we overuse them, so we use them just in case, we're putting a selection pressure for resistant bacteria. So, to be able to continue treating patients that need the treatment, we need to stop using the antibiotics just in case as a backstop, because that will ultimately result in these drugs being less and less effective.
So it's the right antibiotic, the right dose, the right duration.
Yeah, so it's not just a matter of picking the right drug, it's making sure the conditions to resolve the infection are optimal. So there is an element of pharmacokinetics. There are some drugs that are going to work better in some locations, but also you have to consider optimizing the body's ability to resolve the infection. So antibiotics don't replace the immune system, they help the immune system to overcome an infection. And a good example would be an abscess. If you don't drain and lavage that abscess, the antibiotics aren't going to get rid of it. You need to use other techniques to try and optimize the infection of resolving. Same with the pyothorax, you know, drain the pus. You know, so it's not, you know, antibiotics aren't a one solution. You can actually support the body in other ways to help it resolve the infection.